In part 2 of the online videos about anxiety disorders, we're going to cover panic disorder. Now, the diagnostic criteria for panic disorder describe it as recurrent, unexpected panic attacks, followed by at least 1 month of persistent worry about having additional attacks or their consequences, and or significant maladaptive changes in behavior because of the attacks. This definition obviously brings up the question of what is a panic attack. So the DSM-5 defines a panic attack as a discrete period of intense fear in which 4 of the following symptoms abruptly develop and then peak within minutes. Now, the possible symptoms are quite diverse and are primarily physiological in nature. Things like rapid heart rate, trembling or shaking, feeling of choking, nausea, chills, paresthesias, which is prickling or tingling sensation, derealization or depersonalization, which is essentially feeling disconnected from your body or yourself, or fear of losing control, going crazy, or dying. In terms of the epidemiology for panic disorder, current research suggests that it affects between 2 and 3% of the population, with onset in the teens or early 20s. Again, we also see a higher incidence rate for women versus men, with women meeting diagnostic criteria for panic disorder at 2 or 3 times the rate of men. Finally, as your book mentions, there are a number of different possible causes of panic disorder, which span biological, psychological, social, and cultural dimensions. First, it's been theorized that both neurobiological and genetic factors may play a role in the development of panic disorders. In terms of neurobiology, studies have shown that people with panic disorder may have increased activity in the locus coeruleus, which is the area of the brain that releases norepinephrine when the organism experiences stress. So the idea is that if this area of the brain is overactive, thereby releasing extra amounts of norepinephrine, people may be more likely to experience panic attacks and be diagnosed with panic disorder. Studies have also shown that genes might play a role, particularly when a person has a polymorphism on the NPSR1 gene, which may lead to a hypersensitivity to stress-caused somatic or physiological changes. Another theory about the cause of panic disorder is interoceptive conditioning, which is a theory based on classical conditioning that states that panic attacks may be a conditioned response to either situations that trigger anxiety or internal bodily sensations of arousal. On page 190 of your book, there's a great figure that depicts how this works, but the gist is that a person experiences somatic signs of anxiety, which are followed by the person's first panic attack. The panic attack then becomes a conditioned response to those somatic signs of anxiety. So whenever a person experiences even low levels of anxious sensations, a panic attack follows. Building off of the idea of interoceptive conditioning, cognitive theorists have also suggested that panic disorder might be due to catastrophic misinterpretations of physiological sensations. According to this conceptualization, panic disorders are the result of irrational thoughts regarding the meaning of somatic symptoms of anxiety, which end up creating sort of a cycle between the thoughts and then the resulting feelings. In terms of social influences, research has suggested that panic disorder might also be the result of social learning. And the basis for this conclusion is that people who grow up in households where they observe other people having panic attacks themselves have panic attacks at higher rates than individuals who did not have household members who displayed those same symptoms. And finally, recreational drug use has also been implicated in the incidence of panic disorder, with individuals who have amphetamine, cocaine, and alcohol dependence all showing an increased risk for panic disorder. Because of the diverse causes of panic disorder, the treatments are quite varied. However, the most common is exposure therapy, which was described in the last video. In one particular type of exposure therapy for panic disorder, called panic control therapy, or PCT, therapists expose clients to the somatic feelings of anxiety in a safe environment, and then help the client learn coping skills and also realize that those feelings do not have to end up in a full-blown panic attack. So in that case, you're exposing the clients to the low level of anxiety feelings to help them realize that panic attacks don't have to follow. As your book describes, cognitive and psychodynamic approaches to treatment of panic disorder have also been developed. In the next slide, we'll talk about agoraphobia and also generalized anxiety disorder.